Hi, welcome. I'm Terrell from the Barbell Balance, but you might know me as the Prolapse Coach. I help strong women like you lift heavy, get sweaty, and feel brave in their bodies again with pelvic organ prolapse. So today we are going to talk about intra-abdominal pressure for lady parts. There's a lot of confusion with intra-abdominal pressure, especially with postpartum women or women who have just given birth recently. So if you are here because you are confused by this too, this is going to answer all of your questions and ease your mind. So first, as you can see here, we have the core, right? We're looking inside of what the core looks like. And when I'm saying core here, I'm talking about the deep core system. And the muscles that are involved with this system are your diaphragm. So right here, this guy, your pelvic floor. This here is your pelvic floor. Your multifidus, so this is in your lumbar spine, the muscles deep within your lumbar spine, and then as you can see, your other spinal muscles. And then we have your transverse abdominis, your transverse abs, or your TVA here. And then the abdominal wall with the connective tissue. So the connective tissue is known as the linea alba. So if you've been dealing with a diastasis recti or abdominal separation, and you notice that doming in your core when you get up, or if you're doing certain exercises, you see a little bit of doming or coning along the midline of your tummy. That's actually intra-abdominal pressure pushing through, right? So these muscles here work together, primarily the diaphragm, the pelvic floor, the multifidus, and the transverse abs. They all work together to help manage your intra-abdominal pressure. So your pelvic floor does a lot more than just the typical things we think our pelvic floor is designed to do. So what tends to happen when our pelvic floor isn't working the way it should with your diaphragm is that's when we can experience things like feeling bulging within our vagina, stress urinary incontinence, and sometimes even pelvic floor muscle pain. That stuff all comes up with women who are trying to figure out how to best manage their pelvic health. So it's not all just about the pelvic floor. Sometimes it's about the intra-abdominal pressure and how it's being managed within the deep core system. So we're going to talk a lot about things like alignment, breathing, coordination of it all with movement and Kegels, just so that you have an understanding of how all of this works with movement and exercise. All right, so here is a pop can or a soda can, depending on where you're from. I'm Canadian, we call it pop. But really, what this represents is how our core canister works. So as you can see here, this pop can is closed. So if you were to step on this really, really hard, it would actually be really, really hard to crush it because it's got all of that pressure contained in that spot. So that pressure works a lot like our intra-abdominal pressure within our bodies. Now, if you were to open this can of pop, then that pressure releases, right? So that's where you get that fizzy kind of sound coming from. That is the pressure being released. Now, how this works in our bodies is when we manage our intra-abdominal pressure well, it's well contained within our in our core canister or within our deep core system, like in the page I showed you before. But sometimes what happens, and it's common, is that when we don't manage that pressure, or when we don't know how to manage that pressure, all of that pressure presses downward and it needs to escape somehow. So it escapes by, showing us or giving us feedback like peeing our pants or feeling that bulging from our prolapse, whatever prolapse that you're working with. So what we do is we work on managing that pressure so that we can keep it contained, so that your body can meet that demand of whatever it is you're trying to do. So intra-abdominal pressure is super important. We need it. And this is where people are confused because they want to avoid intra-abdominal pressure because they worry that that is the source of their symptoms, their pelvic health symptoms, when it's actually a system type thing. So it's not just your pelvic floor at play here. It's how all of this works together to manage this pressure. Now, your pelvic floor does play a role, which we'll talk about in a minute. But for this right here, intra-abdominal pressure. So it provides stability and strength. So again, going back to that pop can, when that pressure is well contained, that pop can is quite strong and stable. When it's open and you want to crush it, it's a lot easier to crush because it doesn't have that pressure stabilizing it. So again, we need intra-abdominal pressure to help us move, to meet the demands of that movement that we're doing. And again, if it can't do that, that air escapes, and typically it escapes through our lady parts. It provides support to your pelvic organs. Again, when it's well managed, the pelvic organs will stay where they're meant to stay. When that intra-abdominal pressure is being pushed down, those pelvic organs tend to get pushed down with them. So again, this is where leaks can happen. This is where you might experience some of that heaviness in your vagina or some bulging or pressure down there. And the intra-abdominal pressure changes as we move. So I'll give you some examples of exercises in a bit of high demand intra-abdominal pressure type exercises. But it really does change as we move. So for example, if you're sitting on a couch nursing your baby, and you go to put your baby down, that rotation, that intra-abdominal pressure changes with that rotation. If you go to stand up from a seated position, your intra-abdominal pressure is changing. And this is where even some women experience symptoms when they're getting up off the toilet or off the couch, right? It changes as we pick something up off the floor. It changes as we're vacuuming or doing household chores. Our intra-abdominal pressure is always changing as we change our positions. But the demand also is different depending on what movement or exercises that you're doing. So getting up off the floor from a laying position is going to require more intra-abdominal pressure than maybe getting up out of bed in the same position. Deadlifting from the floor or picking something up off the floor has a higher demand than picking something up off an elevated surface. So it's going to change as that demand changes. So some other things to take a look at when looking or addressing intra-abdominal pressure, and you've probably heard these before if you've been following me on Instagram, I refer to these a lot. So it's alignment, breathing, and then the coordination with movement. So again, you're going to hear these things come up a lot in the work that we're doing together, especially in this training. So going back to that first diagram on the first page, I showed you where the diaphragm is in relation to the pelvic floor, right? Diaphragm here, pelvic floor here, right? So this is what we know, or this is what we refer to it as a stacked position. And this is where you might hear about neutral alignment coming in. And some people say that you must always stay in neutral no matter what. I disagree with that. Our body is meant to move in all different ways, and we can work with our body to meet those demands of that intra-abdominal pressure, because it's just not possible to be in neutral alignment 24/7. So here I am. This is my youngest. I think he's about 6 weeks old here. And as you can see in this first picture, I'm highlighting it here, my ribs and my hips. So my ribs are directly over my hips. Now I'm not standing perfectly because, you know, my body had just gone through this major orthopedic event. So, you know, keep in mind that these are big changes that are happening within your body at such a rapid pace. But I'm actually post C-section here. Now, neutral alignment, again, refers to that stacked position. So here would be my diaphragm just kind of within my rib cage, and then my pelvic floor. So when I'm breathing, I'm inhaling in, my diaphragm is descending and expanding, kind of like, you know, like an umbrella kind of thing. It's opening and widening. And then what happens is that pelvic floor does the same. So it should, when you inhale in, your pelvic floor should kind of lower down and open or relax. And then as you exhale, your diaphragm and your pelvic floor should kind of move up and in. So inhale down, exhale, and lift up and in, right? This is a very subtle thing that most people don't notice until they become aware of it. I remember with my first appointment with my pelvic floor physiotherapist, I actually had this backwards. So that in itself was really good feedback for me. Breathing, again, when we talk about the breathing in relation to alignment, ribs stacked over hips so that the pelvic floor and the diaphragm can work together. And when those, when they're working together, your TVA will automatically activate. So your transverse abs will automatically activate. Your multifidus, so those muscles in the lumbar spine, they're also activating. So we want those all working together. And the starting place is just figuring out your alignment. It's different for everybody. Neutral alignment is kind of relative depending on your body's structure, right? So if you're someone that has scoliosis and you have a natural curve in your spine, you know, your neutral is going to look different than somebody without scoliosis, right? So even taking that into consideration and working with what your body is, or the state that your body is naturally in. With breathing as well, you know, we want to inhale through our nose. So if you want to try it with me, big deep breath in through your nose and exhale through your mouth. Okay, when you're breathing through your nose, so actually that's known as a diaphragmatic breath. So really, I just refer to it as nasal breathing. So when you inhale through your nose, that's when you're going to get that movement or that stimulation in your diaphragm. And then when your diaphragm is moving or stimulated, your pelvic floor will move with it. So inhale and it all drops down and opens, and then exhale and it lifts up and in. So this is why nasal breathing is so important. So if you've ever worked out hard in your life and you can't catch your breath because you're breathing through your mouth so hard, your heart rate is up so high, try to get control of your breath. Take a few seconds and then get that control back. So inhale, exhale. The more you do it, the easier it becomes. right? Again, something that just happens with practice. When you're doing a lot of mouth breathing, your diaphragm can't move as well. And when it can't move as well, your pelvic floor muscles don't move as well either. So if you're ever wondering why we talk about pelvic health and breathing, this is all working together to manage that intra-abdominal pressure so that your pelvic floor can work in a way that's going to support what you're trying to do, whether it's during your workouts or in everyday life or playing with your kids, running in the backyard, jumping on the trampoline, what have you. Usually these things are a pressure management symptom. So when we learn how to manage that intra-abdominal pressure, it can reduce, if not eliminate, some of your symptoms. And then coordination with movement, right? So coordinating your alignment, your breathing with exercise or movement. Now, different strategies work for different people. So this is where it's really important to have all of those options to find what works for you. So you might find when we'll use a squat, for example. I'm an incredibly visual person. When you're doing a squat, typically, or one strategy that we use is, inhale on the way down, exhale a split second before you come back up into the standing position. That doesn't work for everybody. Some people find it works better if they exhale throughout the entire range of motion of that squat. Other people find that it works better when they exhale on the way down and inhale on the way up. So playing around with different strategies will give you more movement options, and then finding what works for you will help you get back to what you're training to do in managing your pelvic health. Now we're going to talk Kegels here because we can't talk about pelvic floor without talking Kegels. Kegels is another strategy that we use to manage your intra-abdominal pressure, but it goes a little bit deeper than that. Okay, so why Kegel? So as I mentioned, when we Kegel, it helps to keep our pelvic organs in place. So for example, here's the anatomy without a prolapse. Here's your bladder here. So it is in a nice, it's in a good, well, where it's supposed to be. The vagina, or this is the bladder. Sorry, I'm a little bit lost. Yeah, so this is the urethra here, cervix, vagina, so the cervix, as you can see, and then the rectum. So what tends to happen is when you have like a bladder prolapse, for example, your bladder pushes up against the vaginal, or the urethra, and through the vagina. So it doesn't have as much space to move. So when it's pressed up and then forced downward, that's when leaks or that bulgy feeling can happen, right? The same goes with the other organs like the rectum. Sometimes the uterus and the vaginal vault, the intraceal or the prolapse of the bowel or the small bowel. I don't work with that as much. That is common though with women who have had a hysterectomy. And this is where we would maybe talk pessary, and pessaries again are a great option for anyone with a prolapse who needs that additional support. We'll talk more about pessaries in another training, but there's just a quick overview. It's like a sports bra for your pelvic floor or for your vagina, right? So when we Kegel, see, as you can see here, when we sorry, I'm going to step back a bit. So when the bladder is kind of bulging through the vagina, then it kind of pushes things downward, as I mentioned, and that's where that bulgy sensation comes in. Sometimes there's leaks with that as well. Or sometimes the leaks just happen on their own. Sometimes it's just pressure and it just feels really uncomfortable. But when we Kegel, whoops, go back there, this all kind of gets pushed up into where is supposed to be, right? So then we can reduce those sensations and those leaks. Again, if the pelvic floor isn't able to do that on its own, then a pessary might be something to consider. So some reasons why, so we'll kind of talk about the Kegel in depth here. So some of the reasons why you may not be able to Kegel is with an overactive pelvic floor or pelvic floor muscles that are always activated. So they're always contracted or in a state of contraction. So it's like you're doing a Kegel consistently or constantly, right? So what happens here is when the pelvic floor is overactive, it's not able to move with the diaphragm and it's not able to manage that intra-abdominal pressure as well. So again, women with an overactive pelvic floor also experience things like leaks. They also experience things, sensations from their prolapse or prolapses. Some women have multiple prolapses. Kylie here, she is one of my clients. We've been working together forever. She was actually told that she would never be able to walk any longer than 30 minutes with 3 prolapses. One is a grade 3. As I said, we've been working together for about a year now. She probably about 9 months in, she deadlifted 153 pounds for 5 reps. She didn't even lift that before her prolapses because she was worried about the disc herniations that she had. She didn't want to injure herself. She didn't want to make her disc herniations worse. So even pelvic floor muscle training helped her in managing her lower back or those disc herniations. Now, that's something that that's case by case, not always, so if you have a disc herniation, please refer to your doctor. If you're working with a pelvic floor physiotherapist, again, make sure you consult with them as well. But Kylie, again, we started off really slow in introducing pelvic floor muscle training, building strength throughout her entire body so that her pelvic floor wasn't working as hard. From there, introducing movement with her pelvic floor. She was also working with her pelvic floor physiotherapist so that we could, so that we were in the same page with her training. But now she's doing crazy stuff with kettlebells and her progress is incredible. Your pelvic floor may need strength, right? It's common for women who have, who are late in pregnancy when their pelvic floor is a little bit more lax or relaxing in preparation for birth. And then postpartum, after birth, especially if you've delivered your baby vaginally, your pelvic floor muscles may need to regain some strength. You can have both an overactive pelvic floor that is in need to build strength. So again, depending on where you're starting from and how your pelvic floor is functioning, we take that all into consideration with where we're starting in terms of your pelvic floor muscle training, exercise, and the management of your intra-abdominal pressure or how that's being managed naturally so that we can so that we can figure out what strategy works best for you in managing those symptoms. So as you can see, this is a holistic approach. We're not just, oh, it's just your pelvic floor. No, we're taking breathing and alignment and coordination and putting it all together. Okay, again, coordination with movement. So coordinating not just your breathing and alignment with movement, but now your Kegel or your pelvic floor muscle training. So we want to coordinate, your movement with exercise or even in daily life with your pelvic floor muscles. So again, if you're working with an overactive pelvic floor or working with, a pelvic floor that needs some strength training or a bit of both, your starting point may look a little bit different. Okay, so then pregnancy and postpartum, some other things to take into consideration with your pelvic health and managing intra-abdominal pressure. Again, especially late in pregnancy, but it happens to women in various stages, depending on a ton of factors. Even genetics play a role. But many women find that they're not able to manage intra-abdominal pressure in the same way they did before pregnancy. Again, hormonal changes play a role. Genetics play a role, how, the size of your baby, all of that stuff. And again, postpartum, when you've delivered your baby, whether it's vaginal or with a cesarean, you might notice that you're a little bit more symptomatic during this time. So again, this is where we want to focus on building strength. Now, the interesting thing with a lot of pregnant and postpartum women is that they can also have an overactive pelvic floor, or that tightness, or their pelvic floor is in a state of contraction. This could be for, again, a number of reasons. Maybe stress, maybe there has been some incontinence or some bulgy type sensations, and contracting that pelvic floor, they're contracting that pelvic floor in hopes to manage that better. But again, women, women in general, we can experience these symptoms even with an overactive pelvic floor. So again, we need to kind of figure out your starting point and learning what is working for you, how. So this is where an internal assessment comes in super handy. Awareness. A lot of the times we just don't know how to use these muscles. We've never been taught how to use these muscles, because really when we think about our pelvic floor or our vagina, we're thinking about, things like sex and giving birth, right? But these muscles work to really stabilize our bodies. So when we bring awareness to these muscles, a lot of good things can happen in managing your pelvic health and that intra-abdominal pressure. All right, so you may have heard that you need to avoid these exercises, and it may be true for some people, but it's not true for everybody. Now, with that in mind, depending on where you are, if you're pregnant, postpartum, if you're experiencing leaks, how you're managing your intra-abdominal pressure, if you experience sensations from your prolapse, you may have heard that we need to avoid these things. But what's more important is training your body to manage these exercises. Again, we're taking into consideration your fitness goals and what your daily life looks like. I use crunches a lot simply because I remember when my daughter was born and just learning about this stuff. It was don't crunch, do not crunch, avoid crunches. I hate crunches at all costs. I didn't personally hate crunches, but that's what I heard, whether that's what they meant, but that's what I heard when learning about this and reading about this and then getting certified in some of the courses that I've taken over the years. Some people really don't like crunches, but in my opinion, and being a mom, crunches are a functional exercise, right? Think about it. If you're sitting on the couch and you're nursing your baby, you want, and you want to put your baby down, or you stand up off the couch, that's a spinal flexion or a type of a crunch. It might not be the traditional sit-up type crunch, but these do, and the reason for this is because they do create more intra-abdominal pressure, which some women have a really hard time managing. But again, this can be trained using modifications. So like double leg lifts. If you're 6 weeks postpartum, yeah, probably not the best core training exercise at this point. But, if you're into CrossFit and you want to get back to CrossFit, you want to do things like toes to bar, really high impact core type exercises, the gymnastics type stuff. We may need to train those double leg lifts at some point. We're not going to start here, but we are going to start training your body to manage that intra-abdominal pressure and to maintain that tension within your core so that your pelvic floor can keep that intra-abdominal pressure where it is, avoiding it being pushed down and those leaking type things happen. Again, these are things to work towards. For some people, not necessarily your starting point. They say any weighted rotation exercises. Yeah, maybe this isn't your starting point right now, but weighted rotational exercises, again, are functional, especially if you're a mom, or depending on the nature of your job. You need to be carrying something and turning your body or rotating your spine, right? So again, if you have a new baby, this may not be as impactful, but as your baby grows and as your demands change, whether it's through motherhood or your job, we need to work on this rotation. And rotation is such an important aspect in how we move. Driving a car, you need to look over your shoulder, you're rotating, right? So again, working towards these exercises might be where you want to go, but may not be the starting point for now. Planks on your toes, or with suspension straps, planks on hands and toes, or moving elbows. So this is kind of like a walking plank. Now, I do coach planks generally on their side to start up, depending on how they manage their intra-abdominal pressure, how they're rotating, and if they're carrying any tension within their chest or their abdomen. It's common for women to want to suck in their bellies to make them appear flatter, but again, that can affect how we manage intra-abdominal pressure. So again, maybe planks aren't a starting point for now, but these are things that I work towards. I even coach eccentric push-ups because it's a great way to train your body to manage intra-abdominal pressure, build strength and core stability and spinal stability, right? So yes, they do these exercises, these core exercises do require a higher demand of intra-abdominal pressure, but when you're training your body and you've worked towards these exercises, your body will be able to handle them, including your pelvic floor. So a good strength training program, full body strength training program, will really help you work back into these things. Okay, so things to consider when modifying your exercise program. Okay, so again, managing the intra-abdominal pressure. Now this is my client, Alyssa. She's now 5 months postpartum. She was really frustrated in how the training in the beginning started because we were teaching her how to manage that intra-abdominal pressure that she had, but she had a prolapse and she had a really hard time with her symptoms. So we had to teach her from the beginning. Of course, you know, she had just had a baby, her pelvic floor needed retraining, her core needed retraining, and we had to rebuild her strength, right? Just the other day, she texts me all excited that she's able to do multiple sets of chin-ups without any symptoms. So this is huge for somebody. And again, at 5 months postpartum, it's incredible, but she's worked really hard in making this happen. And she will be the first to tell you she did not bounce back post-pregnancy, but she's really happy with the progress she's making. So some things to consider. Weight training, both upper and lower body, where the weight is heavier than 50%. So if you, so on a 1 to 10 scale, if the weight that you're using feels more like a 6, you know, there's going to be a higher demand of intra-abdominal pressure. So again, you know, when you're increasing intensity or increasing the load on your lifts, take that into consideration that you might experience a change in symptoms simply because this is a new stimulus for your body. Your body is learning how to do something different. If it's really uncomfortable, again, you may need to take a step back and continue your strength training before going above that 50% 1 rep max, or that 5 out of 10, kind of on that 5 out of 10 scale. Long stride or deep lunges in any direction, forward, back, side to side, and walking. Some women have a really tough time managing intra-abdominal pressure with lunging or the deeper lunges. Especially with a longer stride, again, because of the demand of the intra-abdominal pressure. So things that we might look at: breathing. How are you breathing while you're doing these lunges? What does your alignment look like? Are your ribs stacked? Okay. You know, again, once we check those boxes, and if symptoms are still happening because of that intra-abdominal pressure, then that just tells us that we need to take a step back and continue the work, and then try again in a couple of weeks. Wide-legged squats, again, a very kind of vulnerable type of position. Deep squats, you know, you probably see a lot of these in yoga. You know, again, checking your breathing, checking your alignment. If that still isn't comfortable for you, finding a modification that is. So it may be a narrower stance, because that might be how your body is managing that intra-abdominal pressure right now. And then again, we test and retest. Exercises with both feet off the floor or unassisted. So some tricep dips, that where, you know, like you're doing your dips on an elevated surface maybe, or your legs are extended away from your body, so bringing your legs closer to your body might be one way to manage that intra-abdominal pressure and train your pelvic floor before intensifying it by doing those dips with your feet elevated up off the floor. Pull-ups or chin-ups, again, when they're unassisted, there's so much more demand of your core that, you know, requires how a lot of tension and intra-abdominal pressure for that. So if, you know, you find that you're symptomatic doing these exercises, where is that? Why are you experiencing those symptoms? And then, you know, seeing if there's a variation that works. And again, building full body strength in order to make that happen. Whew. Even body weight training exercises like push-ups, burpees, you know, these, you know, we think, oh, just do body weight exercises, but a lot of body weight exercises require a high demand, right? So again, I do coach eccentric push-ups, but you can modify them by going on an incline or dropping on your knees. I prefer doing the incline because um, it does train your core strength as so that you can meet that demand of the push-up when you're ready for the full-on push-up. But, you know, if you're more comfortable dropping onto your knees, that's okay too. All right, so some other high impact exercises. So running, a body weight exercise, right? Running up and down the stairs. Well, actually, people find running up the stairs much easier on their symptoms than running down the stairs. So if you're starting off with running, well, again, a solid strength training program is going to help you meet the demand, and then introducing running or low impact running drills before, you know, and then going into running intervals, you know, testing and seeing how running is working for you. So again, running down the stairs, probably something that we're going to do a lot as mothers. I know I do when I hear kids screaming and I'm kind of upstairs doing my thing. It's like, I got to run downstairs. So, you know, again, body weight exercises. Jumping is another body weight exercise. So a lot of women find that they have trouble with jumping, box jumping, skipping rope. Trainable things, we can find strategies that work for you, breathing, alignment. Maybe you need a Kegel when you're doing these kinds of jumps. Now, double unders and single unders, a whole different ball game. But again, looking at how you do those movements. What's your alignment and your breathing look like, right? Boxing, lots of changes in direction, you know, lots of rotation. So probably not your starting point. However, something that you can work towards. High impact exercises and HIIT class workouts. So this would kind of be like a step class, or you know, kind of running on the spot, or, you know, some Tabata type workouts. You can do low impact versions of those workouts for sure. Again, these things are not off the table forever, but if you are managing your pelvic health because you're experiencing these symptoms, then, you know, we pull back a little bit, assess what is happening, how that pressure management is working for you, so that intra-abdominal pressure, and then building on that so that you can do those high impact classes without feeling uncomfortable. A lot of sporting drills. So, you know, those touch tests where you sprint and then you put your hand down, then get up and you run, and then you do it again. And you kind of see how many times you can run back and forth for a set period of time. You know, sports like soccer and tennis, high demand and intra-abdominal pressure, but that's all trainable stuff. So, thank you. Thank you so much for joining me today. This concludes my presentation. But again, all of this stuff is totally trainable. When we learn how your pelvic floor muscles are functioning, we can then discover what is going on with the intra-abdominal pressure to see if we can find something that works. So remember the ABCs, and starting off with a solid strength training program that integrates your pelvic floor and takes it all into consideration. So again, I'm Terrell Baldock. Thank you so much for joining me. And if you have any questions about this training, please pop your questions in the comments below. And if you